Alan White, Professor of Men's Health at Leeds Beckett University. There's been a massive change in the way that public health is managed in the UK. With the move into local authorities and under the auspices of the Health and Wellbeing Boards, we're now seeing a much closer view of public health from an environmental perspective, education, employment, opportunities to look at where these men are living, opportunities to look at the employment and what happens to men when they're unemployed, because these are the things that are causing so many of the men's problems. Under these boards, there are also scrutiny boards, and we can use these scrutiny boards to our advantage. And I think that what's been happening with the Men's Health Forum, national charity on men's health, where they've been putting in freedom of information requests to these local authorities, asking are they taking men's health into consideration, is so important, because there's huge gaps emerging. And the more we make these boards aware of those gaps, the better it is. They've just created 10 questions that every scrutiny board should be asking. If we use those to our advantage, we should be able to get, as in Haringey, as in Greenwich, reports on men's health, directors of public health writing their reports on the state of their men's health in their areas. Leeds has just commissioned us at the Leeds Beckett University to undertake a year's review on the state of men's health in the third biggest city in the UK. What it's showing is a really detailed insight into what's happening across a whole city. That wouldn't have been possible without the support of a local authority as well as the health authority. So, where are we going with this? A report's coming out. It's going to hopefully change the way that men's health is seen in Leeds, and perhaps from that it can be a model that can be adopted elsewhere.